Okay, more respiratory system anatomy. Today we are talking about your voice box. Hopefully you watched that lung dissection video. He does a great job showing all of this stuff. So the voice box is that thing we call the Adam's apple, something that you can see when we remove all the muscle and skin. Actually a big site of muscle attachment. So if you remember, this bone right here is called the hyoid bone. This here is the thyroid cartilage. This is the cricoid cartilage, and then it attaches directly to the trachea, or the tracheal cartilage. This is also where that thyroid gland, you only see half of it here, wraps around. When you look at it from the top, you can see that epiglottis, and which is why I like that dissection video, because you see how big that is, and it wraps around this to cover and protect the airway from food and liquids from going on. And then when we break it, hopefully, not break it, but pull it in half, you can see the vocal folds that make where your voice box, why this is called your voice box, because this is where sound is produced. And then it connects directly into the trachea. So we're going to talk about each of these parts. You might want to have some highlighters today to do a little bit of coloring. So the first part, of course, is the epiglottis. Epi means upon, so this thing is on top of the larynx, basically. This whole structure is called the larynx, from the hyoid down to the cricoid cartilage. So the epiglottis is all about protection, of course, controlling food and air movement. So it controls, oops, a little too high, sorry, air in, okay, and then it controls food or liquid going into the, oh God, I just forgot the word, going into the epiglottis. Epiglottis, not the epiglottis. Ugh, I just literally forgot the word. Esophagus. So, when we look at this, it's divided into a couple of parts. This inner area is called the glottis, which is why it's nice to have some highlighters sometimes. The glottis's job is to make distinct sounds with the help of the vocal cords. Of the vocal cords. So they're going to help with that vibrational piece. The hyoid bone, which you can't see here, but you can see here. This bone, remember, it's a funny U-shaped bone with these two little teeth because muscles attach there. The hyoid bone connects the larynx to the body. And it's just, like I said, site for muscle attachment. So all those neck muscles are attached there. The thyroid cartilage, this big piece here, which you can feel if you feel your neck and talk, you'll feel it vibrate. So if we go down to the bottom here, this area right here, and this area from the side is the thyroid cartilage, so part of that because that's what the thyroid connects to. This is what we nickname our Adam's apple. And its also job is production of sound. which is why when you get hit there, sometimes it's hard to talk. The next little piece is the cricoid cartilage. Sorry, I did not grab enough highlighters. Oh, and blue is probably not a good color choice. Okay, we're going to go with pink. So this little cartilage right here and here is attaches muscles and the thyroid gland. The attachment site for muscles and the thyroid gland, which you already knew. So this little half of it right here, and then you can see some of these muscles coming in, pretty much cover the cricoid cartilage, which you can see right here. Thyroid cartilage, cricoid cartilage, and this is the little sweet spot that if they're going to crike you, not trach you means they're going into the trachea. Criking you means they're going into this spot right here to put in an airway. That's where that attaches. And then you have this weird thing. You have these vocal cords. So there are true vocal cords and there are false vocal cords. So the true vocal cords are two little ligaments that vibrate to produce sound. And you've been playing with this all your life, and some people are better at it than others. A lot of you are really good at talking like other people, mimicking other people, because you have good control of your vocal cords. Some of you have had vocal cord training because you're in the theater program or you're in the choir program. And then there are the false vocal cords. So these guys are weird because their job is protection. So they're what you see from the top. They're kind of the last thing to keep food and liquids out of the trachea. Trachea. So they keep it out of the larynx and lungs, and they make no sound. So when you're looking at it from the top, although I already took it apart, it's kind of, so this is the epiglottis, you actually see this little fold right here. So that's the false vocal cords. And then the true vocal cord is on the bottom. So if you look at this picture down here, the vocal fold is this region right here. And the false vocal cord, or the vestibular fold, is this region right here. So we're just going to now leave the upper airway, right, because this is kind of the defining line, and then we're going to go and talk about the lower airway.